Some studies have estimated that as many as 80% of women will develop fibroids by the time they reach their 40s or 50s. I'm Dr. Jolene Brighten, and in this video, we're going to chat about what are fibroids and what can you do about them naturally. Now, we'll talk a little bit about other treatments that are available as well, because I don't think we should be going all or nothing in terms of do it all natural or only go for surgery. So, we're going to talk about some of the options. But first things first, what are fibroids to begin with? Now, excuse me, fibroids are benign tumors. So, they are growths in the uterus and they can be quite painful. They can also lead to heavy bleeding. And of course, they can cause enlargement of the uterus. So sometimes what women will experience is a bit of bloating, changes in bowel movements. They will feel like their lower abdomen is getting quite large. Or they're now having heavy periods with lots of clots, and maybe they're even experiencing increased in pain. And in some cases, fibroids can actually cause fertility issues as well. It can interfere with implantation. And depending on the growth of the fibroid, it may even keep baby and or egg and sperm from needing to produce a baby. So, in that, it's really important to understand that if you do have fibroids, you do have options. There are things that can be done about it. And if you're thinking about having a baby, having that discussion with your doctor. So, I explained that uterine fibroids are not considered cancerous. They're considered benign growths, and they're either going to be attached in the wall of the uterus so in the wall or attached to the wall. And so there's several types of fibroids. So there's the intramural fibroid. Can I get that word out? That is when the growth is in the muscle wall of the uterus, and that the muscle of the uterus is called the myometrium. There's also subserosal, submucosal, pedunculated, and all of these are just different terminology to describe where the growth is at and what it looks like. Like pedunculated fibroid, it has a stalk-like growth, so it has like a little stalk, and then at the end there will be this slender base, and so it looks like basically a very narrow stalk with a growth on the end. Now, fibroids can really vary in size. And we also see that there's certain times where women are more susceptible to fibroids. So, fibroids, like the lining of your uterus, respond to hormones, so your natural estrogen and progesterone. So, we see that women who are pregnant sometimes develop more fibroids, or we'll see fibroids developing in states of estrogen dominance, which I have other videos on that you're welcome to check out. And in some women, fibroids actually shrink and go away as they enter into menopause. So, what happens there? We actually lose our own endogenous hormones at the same levels they were when we were a menstruating female. So, in terms of the cause of fibroids, what we do know is that estrogen and progesterone, your cyclical hormones of your menstrual cycle, can stimulate the growth of fibroids, which is why we think that they shrink when a woman stops ovulating and stops having a period. And, it's important to note that sometimes women are offered hormonal birth control, specifically the pill, as a way to prevent fibroids. But, there are experts out there that say, listen, if your natural hormones can stimulate fibroids and these synthetic ones are looking a lot like them, they can attach to the receptors and increase the growth of fibroids. And in fact, there was a recent study that showed a correlation between the use of oral contraceptives, so the pill, and development of uterine fibroids. So, what does this mean? Does this mean you shouldn't use hormonal birth control if you're trying to prevent pregnancy? No. What it does mean, though, is that if you have a family history of fibroids, so you know your mom or your sister had fibroids, then you want to have that conversation with your doctor before starting hormonal birth control. You can actually have an ultrasound done if you are symptomatic and have the uterus checked out to make sure nothing's going on before you start hormonal birth control. And then, of course, at any time, if you're on hormonal birth control and, excuse me, you're getting changes in bowel movements, you're noticing this weight, this heaviness in your lower abdomen or your pelvis. And, you might start having abnormal periods. Maybe they come a little heavier, a little clottier, a little more painful. Then definitely see your doctor and get it checked out. And I wrote a whole book about women's hormones and being on hormonal birth control and coming off of it called Beyond the Pill. So I would definitely encourage you to check out that resource as well, and to understand that the hormonal birth control can actually thin the uterine lining. So, with that, you may not find that your periods actually change much until you come off of hormonal birth control. And that may be when a fibroid gets discovered. Now, we've talked about a few of the symptoms of fibroids, but what else should we be looking out for? So I want to touch on some other things that I haven't talked about. Another is difficulty urinating. So we've got the heavy periods, spotting, bleeding between periods, even prolonged periods, periods that don't quit, and that feeling of fullness in the abdomen. And while I said, multiple times look out for changes in bowel movements like constipation, you also want to look out for issues with urinary urgency, frequency, finding it's difficult to go pee, if you're having pain with sex, pain in your lower back, or pelvic pain altogether. And then certainly if you are fatigued, you always want to see a doctor and find out why your energy is so low. And then, as I mentioned before, fibroids are linked to fertility issues, the ability to become pregnant and maintain that pregnancy. So, if you're struggling with infertility, that's worth investigating what's going on, and perhaps what's underlying that is fibroids. Excuse me, I have a tickle in my throat. As soon as I decide to start talking, here comes the tickle. Now, with the uterine pain, I want to say that a common symptom of fibroids is pain. But just like I talked about in my endometriosis video, not every woman has the same symptoms. So just because you don't have pain, that you're having the other issues, doesn't mean that you should write off fibroids. But if you are finding that you're popping, NSAIDs, so over the counter painkillers, and hugging a hot water bottle, and you just feel like your periods are owning you, that's definitely worth getting checked out. Now, what do we check out? I've said that a few times, right? Let's talk about how fibroids are diagnosed. Now, generally speaking, women have a pelvic exam these days about once every 3 years. So that's your women's annual. With the new changes in terms of how we're advised to do physical exams, not all women, because we're not doing a pap every year unless there's HPV positive or other factors at play. With that, we're only meeting with women maybe once every 3 years. So that's to say, don't necessarily expect that you're going to go to the doctor and you're going to have a pelvic exam unless you bring up these symptoms. So track your symptoms, track how heavy your periods are, how painful are your periods, how often are you bleeding, is it every 21 days, are you bleeding for more than 7 days, and be ready to discuss that with your doctor. Now, based on that, and perhaps doing a pelvic exam, your doctor may order a pelvic ultrasound. That's usually a starting place, is to start with an ultrasound to actually visualize what is going on in the uterus. But there's also other procedures, other diagnostic tools, and imaging that may be used to actually view the uterine cavity even better. So, in some instances, they'll actually fill fluid into the cavity so that basically the tissue is presented in a way where you can get a really clear picture of what's going on. In some cases, your doctor may recommend an MRI, but that's not something most doctors go straight to, because one, it's really expensive, and that tends to be reserved for surgery planning. So once fibroids get to a certain size, they generally need to have surgical removal. And that might be when your doctor does the MRI. So don't expect that they'll jump to that right away. Ultrasound will be the most likely imaging that they order to visualize your uterus. Now, blood tests. This is a question I always get. What about blood tests for fibroids? There's not really any blood tests that can diagnose fibroids, but we do want to do some investigation. So, for instance, checking vitamin D levels. We know that vitamin D deficiency can be linked to an increased growth in fibroids, or fibroids being present. So, there's a correlation there. And I have a whole guide at drbrighten.com all about vitamin D. It's very comprehensive. I'll go ahead and link it here so that you can take a look at that, because in it, I give reference ranges of what your blood should look like in terms of your vitamin D levels, and also what the Vitamin D Council says about appropriate supplementation. So, people with vitamin D deficiency, that's all of us that live in the Pacific Northwest, or the further you get from the equator, and those women who have dark skin, they can also be at higher risk for a vitamin D deficiency, as can people who don't go out into the sun much and stay inside a lot. So that's one blood test worth investigating, as is looking at your estrogen levels, but not just estrogen. As I talk about in Beyond the Pill, we also want to look at estrogen metabolites. So 2, 4, and 16 hydroxyestrone. The reason for that is it is possible, and I've seen this clinically, where women have low normal estrogen, but their metabolites are the least favorable kind. And that's contributing to the growth of fibroids, heavy periods, big clots that are bigger than a quarter size in their menstrual blood, and so much more. So, when you're testing, you want to look at the metabolites as well. And I think it's great to, if you can get LH test strips, figure out when you ovulated, test your blood about 5 to 7 days afterwards, or doing something like the Dutch test, which is a dried urine analysis to look at your estrogen, progesterone levels, and what are those metabolites as well. Because if your metabolites are off, so let's say you're making more 4 and 16 hydroxy, we really want to shift that into the 2 hydroxyestrone pathway. And we can do that by adding broccoli sprouts to our diet and cruciferous vegetables, taking a supplement like my the Balanced Women's Hormone Support that has DIM in it and calcium D-glucarate to really help support the metabolism, the transport, the excretion of estrogen. Estrogen is amazing, but the wrong kind of estrogen or too much of it hanging around, it can be really, really big trouble in women's health overall. Now, I brought up already, if you have a family history of fibroids, it's worth bringing up to your doctor. And women of African descent are more likely than other women to experience fibroids. So that's an important consideration as well. So if you're hearing some of these symptoms, you're nodding your head, you're like, that sounds like me, then definitely make an appointment with your doctor. Now, asked some of you send in your questions about fibroids, and one question I got was, "Do fibroids make you gain weight?" And I'm trying to cover as many of these questions as possible without making this video too long. But here's the thing: fibroids don't really like cause you to gain weight, but they can cause bloating, swelling, constipation. And so, in that way, we could see the number on the scale going up. I mean, if you're not evacuating your bowels regularly, and the fibroid is growing quite large, it's possible that you'll see your weight go up, but they don't directly cause you to gain weight in the sense of increased adiposity throughout the body. Or, in other words, fat cells. That's what adiposity means. So, adipocytes are fat cells. All right, so let's get into treatment and let's talk about what can be done for uterine fibroids. As I said, when fibroids get to a certain size, it's going to be necessary to have a surgical removal. And I've never had a patient who didn't have large fibroids that wasn't super happy to have that as an option and to get those removed. But let me say this. Surgery will not address the root cause of why you grew fibroids in the first place. Could be a very necessary treatment and exactly what you need to resolve your fibroids in that moment. But you still have to work on some of the stuff I'm going to talk about today so that you address the root cause and that the fibroids don't come back, because they can come back if you're not making the dietary and lifestyle changes that really help prevent them. And so, just keeping in mind that the only person that can know what is best for you is really you, and the way that you get educated about that is having an individualized discussion with your doctor. So surgery is one option. Some people ask or have been recommended to have a hysterectomy, but, hysterectomies are more like, that's like if nothing else works, then we think about hysterectomies. It's not a go-to treatment for this. If you are a woman who's totally done having children, you're having significant symptoms like bowel obstruction, incredibly heavy or painful periods, and urinary issues that are keeping you from being able to participate in activities of daily living, this may be something that you want to discuss with your doctor. And then, of course, understand the hysterectomy doesn't address the underlying issue, and that these issues in terms of fibroids, if it's because of the estrogen metabolites, well, those estrogen metabolites can stimulate your breasts, they can stimulate your ovaries, so you definitely want to take a look at that piece as well. Now, some other therapies that are used is uterine artery embolization. That is, it's less invasive than a hysterectomy, and basically, it's all about blocking the blood flow to the fibroid so that it doesn't get fed to grow, so it stops growing. Endometrial ablation is another procedure that it's effective in destroying the uterine lining. And so, when there's excessive menstrual bleeding, there's anemia you can't get ahead of, and fibroids present, this is sometimes doctors will discuss this treatment with women. Now, there are a few drugs like Lupron. Outside, we talked a bit about hormonal birth control, which can work for some women. And then there's also Lupron, which it's essentially shuts down hormone production and that deprives the fibroids of what they need to grow. So, what's important to understand about this is that sometimes things can get a lot worse, in other symptoms while the fibroids are getting better. So, of course, with any pharmaceutical, there's always side effects, and you want to review all of that with your doctor. Now, we talked about the pill, but a different contraceptive that some women will elect for is the Mirena IUD. And so with that, I have seen women get a progestin-based IUD and have that placed in their uterus, and that does help with fibroids. And so again, it's always about what is true for you. Okay, so let's dive in now to how to treat fibroids naturally. So, number one is we have to address the estrogen dominance and the metabolites that might be present. So, that 2,4,16 hydroxyestrone, we can get that done via lab testing and then understand what we need to do to really support our system. So, we metabolize our estrogen through our liver, and our liver packages up these metabolites and puts it into our bowels to be removed from the body. Now, you also secrete estrogen excess. This is all excess, what you don't need anymore. You also secrete this through your urine. But when it comes to the bowels, if you have dysbiosis, so you have overgrowth of critters that really shouldn't be there, and they make an enzyme called beta glucuronidase that will actually reactivate your estrogen, put it back into circulation, unbound to proteins, which means that it can go wreak havoc in the system. And then we can have symptoms of estrogen dominance. So, in that, we have to address the estrogen dominance. Again, eating cruciferous vegetables. So, you can get something like a fourth a cup of broccoli sprouts, little tiny sprouts. They're delicious. And that's as potent as about 2 pounds of broccoli. So, that's some good stuff in terms of supplying you with the end ingredient we really want, which is DIM. And with that, DIM helps you shuttle estrogen into the more favorable pathways for those metabolites. So, eating cruciferous vegetables, getting plenty of fiber in. So, aiming for about 25 grams a day minimum. That way, you are having regular bowel movements, drinking plenty of water to have those regular bowel movements as well. So, you can eliminate that estrogen you no longer need. Now, one risk factor for developing fibroids is actually having increased adiposity or higher body fat percentage. So, estrogen is stored in fat cells, and in addition, fat cells can make estrogen. So, one treatment is sometimes to help with changing body composition. Please don't mishear me to say you just need to eat right, exercise, and lose weight. What I'm saying is that we're changing body composition. You may not actually lose weight. You may actually gain weight, but who really cares? Because what we're talking about is muscle mass versus fat mass. And fat is good. We need some of that. But if we have too much adiposity, too many adipocytes, too many fat cells compared to muscle cells, that can affect our metabolism. But also, both your muscles and your fat cells are endocrine organs. They have the ability to make hormones. So that's very, very important to understand. So we want to optimize body composition and we want to eat a hormone friendly diet. So I actually have a link for you on a guide that has a meal plan to help you get started and understand, some of the best approaches in terms. That was my dog just scared me. If you just saw me flinch, That's real life right there. So, in terms of what I've been talking about with some of the dietary components, if you go to drbrighten.com/hormone kit, I have a whole meal plan there for you about incorporating inflammatory reducing foods, helping support your liver in doing its job right to get those estrogen metabolites correct, and supporting you in terms of eating the foods that your body needs, the nutrients to build better hormones. So definitely check that out. Now, another treatment that women have found helpful and have reported to me, I am not an acupuncturist, but my patients have told me, this minimally invasive treatment has really helped give them pain relief and it's been shown in the research that acupuncture can help with some reproductive issues like infertility. So, acupuncture is something that's worth considering, and you can always talk to your doctor about that. Now, what happens though if fibroids go untreated? So, what happens if we don't treat the fibroids? Well, some they'll be completely asymptomatic and nothing happens. And in others, they'll continue to grow and they can become very, very painful. And they certainly can, lead to all the symptoms that we talked about. But, one of the best things that you can do in terms of understanding how to approach your body is to track your symptoms, make sure you understand what's going on, and then bringing in some natural interventions like making some dietary changes, increasing muscle mass through weightlifting, walking, so we can start to shift our body composition. And I just did two ends of the spectrum there, walking and weightlifting. That's all I say is just move your body. Getting optimal sleep, that's when our body recovers, repairs melatonin. Sleep hormone is also really, really important antioxidant. And in that time, you're getting good sleep, your cortisol's coming down. Now, that whole stress response system can actually shift. So you have more favorable progesterone levels. And, why I'm bringing all of this up is that you may elect for the surgery, you may elect for medications, and those may be necessary. But like I said, the surgery will not address the root cause of why you developed fibroids to begin with. And again, so what if it's something like you have a vitamin D deficiency, that component on top of things? Well, then you definitely want to check into, your vitamin D levels and make sure that you're supplementing appropriately. So that way you're addressing what may have caused you to develop fibroids to begin with. And if you do need to have a surgery, knowing that you're taking all the best steps that is actually going to help you recover better from that surgery and trying to be preventive in those fibroids from coming back. Now, I'd love to hear from you. You listen to this video. Do you have any other questions? What were some aha moments? And have you personally experienced fibroids and what did you find helpful? Let me know below. And then, of course, if you haven't subscribed yet, be sure to do that. My channel is full of helpful information targeted to women, supporting them with their hormones and supporting them with their health overall.